Hello, I am Alex Tarnowski for the Power of the Patient Project. Today, we are joined by Bob Kaiserman, who is the Executive Director of the Power of the Patient Project. Bob is here to tell us about an exciting new program that is being launched to connect with patients throughout the country. It is called Tell Us Your Story. So welcome, Bob. Thank you for joining me today.
Thank you for having me.
All right, so I would love to get to know more about this program that you're launching. So I have a couple questions for you. Is that all right? So first up, please explain to our audience what this new campaign is all about.
We have put together over the last 12 years what we think is, excuse me, the most comprehensive patient portal probably in the country, filled with an extensive library of video content, resources that people can tap into on mental health and other issues. And we want to make it more interactive. So one of the things we are hoping will happen is that with this program, which we're launching in a few days, people will take out their cell phones or their cameras and shoot a short video explaining a story that they want to share about a positive experience or a negative experience at the doctor, at the hospital, so that others could benefit from it as well. The Power of the Patient Project is deemed by the National Library of Medicine as the National Library of Patient Rights and Advocacy. And with that, we have a responsibility to represent the viewpoints of the patient. Now, when we talk about a patient, we're all patients. So this is not just patients with chronic disease. This is all types of people with all kinds of issues. And throughout our lives, we visit doctors, and hopefully we don't get hospitalized too often. But there are stories that we want to share. The concept of the project is to encourage people to be more empowered, to exercise their rights as patients. So that's what the new campaign is about, and we hope that people will respond to it and allow us to share their viewpoints and their experiences with others.
That makes a lot of sense. And I think I personally would actually really love to contribute that kind of thing, because there are so many stories that, even though I'm a relatively young person, I think are important to share. My second question would be, why is it so important right now that patients share their stories?
I think that people went through, either personally or through a family member or someone they knew, the anxiety, the pain, the upset that came with so many cases that were dealt with during COVID-19 and still are being. It brought a greater awareness of our healthcare system. It certainly brought a greater awareness of the people who contribute to that system, the unsung heroes, the doctors, the nurses, the therapists, the people who work behind the scenes in the hospital. And I think that people need to be conscious of the fact that we need to speak out, that we don't simply accept things that are not going right with us in terms of our medical care. So we hope through this program that people will express issues with medical billing, frustration with insurance. On the other side, where the insurance has been absolutely wonderful and paid for everything that has to be done. So we're not trying to bash the medical industry, far from it. We want good stories, and we want not so good stories, but hopefully we'll end up with more good stories than bad stories. But we invite both. But that's why right now it's so important, because people have probably never, ever in the history of present generation, my generation, experienced so much interaction with the healthcare system.
Got you. Yeah. And I think having a good spread of those stories, both positive and negative, actually brings more light to the reality of situations in the medical field. So I think that's a really cool opportunity that you're opening up for people. So my last question would be, how can folks contribute their stories to the Tell Us Your Story campaign?
Okay, we have established on our website, which is thepowerofthepatient.org, a special page for these videos. We needed an MP4 format. They can be 3 to 5 minutes. It can talk to us about an experience. It can talk to us about their overall concept of the healthcare system. We invite that as well. And probably most important, the recording can reflect what's important to an individual as a patient. And so they just have to send us the file and we'll take it from there. And once it is added to the website, we will definitely notify the sender to let them know it's there. And our hope is that we will gather a gallery of many, many experiences that people can tap into, watch, and together unite in terms of their experiences. So it's quite simple. We want them to send it to the email powerofpatient@gmail.com. That's powerofpatient@gmail.com. And we will receive them that way, and we'll acknowledge them when we get them, and again, tell people when they are posted to our webpage.
Sounds perfect. I'm really excited for this kind of opportunity to share stories. This one of the things that I personally love doing. It's one of my goals to be able to share as many stories of my own and other people's that I can. So thank you so much for joining me today, Bob. Once again, I've been Alex Tarnowski for the Power of the Patient Project, the National Library of Patient Rights and Advocacy. Thank you for joining us.